All right, Nisha the PA, we are live.
Hey guys, it's Nisha the PA over here at Dr. Emer's office, and today I have my gorgeous client, and we're getting started on one of her first treatments, which is a combination treatment of right now Halo. Now, in addition to doing Halo, we're going to do a little bit of CO2 to her cheeks, give her stronger treatment, because as I've mentioned a couple of times before, sometimes in the areas that you have the most concern, which in her case is acne scarring, you do want to do a little bit of stronger treatment for that area. Now, once again, get into this Halo device. Halo is one of my favorite lasers in the office for several different reasons. Number one, Halo is operating at 2 different wavelengths. That's right, it's operating at a more superficial wavelength that's producing these little white dots that you see on her forehead. But it's also operating at a deeper wavelength, and that wavelength is producing a lot of the redness and erythema that you see on her skin. Now, the beautiful reason or the beautiful response to this machine operating at 2 different wavelengths is that number one, she's gonna get immediate results from these little white dots, the more superficial part of the laser. Now, her results will only continue to get better because the deeper part of the laser will continue to produce collagen, elastin, and remodel her acne scars.
All right, people are asking what is going on. What are we doing this for? We are doing this for our patient's acne scar treatment right now. Before this, she did do a chemical peel to prep to prevent some pigmentation from happening. Guys, we're doing our Halo to resurface the skin all over, and we're going to use some CO2, which is a stronger laser on the cheeks.
2 more swipes.
When getting laser treatments done, some lasers hurt less than others. Yes, that's very true. Some lasers you will feel a lot more than others, depending on the setting too.
It depends on your pain tolerance, but as you can see she's a little bit swollen in these areas. That's because we did nerve blocks to help this treatment a little bit more comfortable. We can do a combination of, typically what we do is a combination of topical numbing in the office and then nerve blocks to try to make it as comfortable as possible, because these lasers can be a little bit spicy on the upper lip, okay? Just really quick. There you go. Really good job. Now remember, we're here to make you as comfortable as possible, but to treat your acne scarring or your concerns as aggressive as possible to give you the best results. With this combination treatment of Halo to her full face and then CO2, our stronger laser to her cheeks, she's gonna get the best results. But I always say this, when it comes to taking care of your skin, when it comes to doing laser treatment, it's never a one and done. I really wish I had a magical laser that can improve your skin tone and your texture and make your skin perfect in one setting, but it really doesn't work like that. What are they saying, Jordan?
What is this and for what?
So we are using Halo in this particular case for acne scarring. I want you to take a look at my beautiful client. Look at her cheeks. She used to have really bad acne scarring, and now she no longer has as many outbreaks, but she does have remnants of when she did have the acne scarring. She has a little bit of red tint to her face and irregular texture and tone. We're going to be using the Halo device, which is an ablative laser, a dual wavelength laser. It's operating at 2 different wavelengths. A superficial wavelength that's producing these little white dots, and then a more deeper wavelength that's going to continue to produce collagen and elastin as our treatment goes. Now remember, each of these lasers are specifically, we really develop a treatment plan for each individual person. Really spicy, there you go. Each individual person to try to give you the best results possible. In her particular case, we're doing a combination of the Halo laser and CO2, but it's really going to depend on what type of acne scarring or what your main concerns are to see if this is going to be the perfect treatment for you. You guys know how to get in touch with us. We have treatment coordinators in the office, myself, Dr. Emer. We honestly would love to take care of you. You do not have to stop doing lasers because it's the summer, even though summer is now officially over. Give her a little bit of a break. It's spicy. All right, guys. Now, I'm going to go ahead and continue treatment, but let me show you really quick. These are all the dead skin cells that are being sucked off as we're doing the treatment. So every so often, I like to go ahead and wipe those out. Now, it's Nisha the PA, Dr. Emer's office. Remember, it's time to take care of your skin, take care of yourself. Come meet us in the office for an in-person consultation, but you can also do a virtual consultation with myself, one of our treatment coordinators, or Dr. Emer himself. We can't wait to take care of you. We can't wait to treat you. We take care of you from the very beginning when it comes to skincare and prepping your skin with the Cosmetic or Enlightened chemical peel, to the laser treatment, to active care to make sure you're beautiful. Until next time, Nisha the PA, Dr. Emer's office. Bye, guys.